Hello, everyone, and welcome to our podcast. I'm your host, Dr. Harshita Gupta, and we are delighted to have with us once again Dr. Ravindar Bajaj, a consultant pediatrician with an impressive 39 years of experience. Dr. Ravinder, it's a pleasure to welcome you back to our show. For those who may have missed our previous episode, let me provide a brief recap of Dr. Ravindar's distinguished career. He began his journey in 1984 with UNICEF as a special medical officer, leading the pilot program of universal immunization in Delhi. Following that, he served as a pediatrician in the Indian Railway Medical Services, holding the position of Class 1 medical officer for almost 13 years. For the past 23 years, Dr. Ravinder has been a dedicated consultant pediatrician with his office based in Delhi. Dr. Ravinder, welcome back. It's truly an honor to have you on our podcast once again.
Thanks, Dr. Harshita, for a nice introduction. And it's always pleasure talking on the medical issue with Dr. Harshita. So we can have this topic today, and it's one of the very important topic which we are going to discuss.
Great. Thank you, Doctor. And in today's episode, we'll be continuing our insightful discussions with Dr. Ravinder on the crucial topic of autism management. So without any further ado, let's dive into our conversation. So, Dr. Ravinder, could you start by giving our listeners an understanding of what autism is and what is its prevalence?
Autism spectrum disorder is one of the very important diagnosis which is nowadays missed by busy pediatricians. So we have taken up this topic to enlighten the general practitioners and the pediatricians who are running a busy practice and get less time to observe the child. Autism spectrum disorder, once we talk of spectrum, that means it can be vary from mild to moderate to severe. And it's basically a developmental disability which is caused by differences in the brain. So three things are very important when we talk of autism. There is a difference in the behavior, then there is a communication problem with the kids, and there is a social functioning, social communication which is affected by this entity. The incidence, which probably was earlier not noticed too much, in USA it is considered to be 1:68 now as per the DSM criteria, but this disease is basically on the basis of exclusion of other diseases, because many other diseases can have same spectrum. The age factor is also important, and we have to exclude the other causes before labeling the child as autism. So three things probably are very important when we just talk of this autism. And basically the first thing which the pediatrician notices is abnormal behavior. Abnormal behavior means as per the age specific attitude of the child. When the child enters into your chamber, you find something is abnormal. You may not notice certain things. The best thing probably which we normally come across is when the child is entering and you say hello. Most of the child, either the child will be scared or child will smile. And the child will have an eye contact with you. So the first thing you notice is whether the child is having an eye contact with you or not. Now this thing is possible not in the infants. It happens normally at the age when the 1.5-year-old child, 12 months old child, 18 months old child, most of these cases are diagnosed at 2.5 years to 3 years of age, because earlier many things are missed. So if you find something abnormal, whenever the child is entering into your chamber, don't be in a hurry to examine those kids. Just observe the behavior, say hello to the child, just watch his reaction, whether the child is going to give you a smile. Most of the time, because the children are normally accompanied by the parents and child is a little bit scared. So let's first talk to the parents first and see if they have got any cause for concern, even if they are coming for a general checkup or for a vaccination to the pediatrician. So the first thing you should ask is, are you comfortable with the behavior of the child? And most of these parents themselves come out with certain things which probably we should not neglect. So this is the importance of observation of behavior of the child before we label the child as autism.
And Dr. Ravinder, why is it referred to as the autism spectrum?
Uh, this is a since it is a developmental abnormality, and as I told you, spectrum varies. Autism is basically the child is lost in his own world. He will not be communicating with you, but many of the kids are missed because sometimes you find they react to a certain extent, but many of the kids they will be just in the higher spectrum will be showing all those symptoms which I have told you. Uh, and many of the kids they go to the school, even they are sent to a normal school, when but you start getting complaints from the school that child is not mixing with the other kids, child is not playing with the other kids, so they are diagnosed later on. So that's why we call it as autism spectrum disorder.
Yeah, and how is the disease diagnosed, and are there any specific tests for it?
See, the first thing is because, as I told you, these entity is diagnosed by observation, and we exclude the other causes. So the test, whatever they are basically to exclude the other causes, like hearing, because the speech development and the behavior they are all based on the listening part, which is very important before we label the child as autism. Because once you speak, the child starts speaking few words, whether it's a mama or a baba or water. So few of the things normally the child will be starting speaking at 15 months of age, and the child will start getting eye contact with you. Child will sometimes give a smile also when you just talk about his taste. When you show him a toy, child will come and grasp the child. So it's basically observation. If all these things, say, like if the child is a 1 year old child, now most of these kids less than 1 year old child will be having some babbling or they will be pointing. Same is case with the eye contact. And sometimes at the age of say 1.5 to 2 years, if you name the child, ask him who is he, the child will respond. But these kids, they will not be responding, they will be lost in their own words, and stereotype behavior will be there. The thing is, if the child is playing with the toy, you go on calling him by name, or you will go on asking, he will not react to you. He will be in his own world, and if you disturb him, child will become irritable. The another thing which you probably notice is the unusual response to the sensory stimuli also. And third thing you will note is echolalia. What we call is, you ask him your name, what is your name? He will not tell the name, he will say, what is your name? So echolalia is the repeating the words, not responding to that. And child will have difficulty in communication. And sometimes there are tick movements, or you got a flapping hands, some twiddling, sometimes unusual movements, which the parents will tell you that he is always busy with playing with his finger or his clothes or something. And the test which probably required first is the observation and the history taking from the parents. Second thing is your observation. And third thing is the school's observation. Then there are specific tests which when we refer to the psychologist, to those who there are say certain tests like MChat, which probably it's a proforma based test, and you just go on taking the answer one by one. That these tests are based on again on observation. So once you score a higher score, that is again a spectrum. The score may vary from 5 to 10. So the thing is, once you administer those tests and you have excluded the other tests like hearing, I told you, then there are certain mental retardation, the cerebral palsy, the Frolic syndrome, which probably come in out of the preview of this topic. But once we have excluded those causes and it's only a developmental things, then only we label the child as autism. And even in the first sitting, it's not always advisable to label the child as autism, because this is a trauma for the child, the parents, because they get disturbed. So be very careful Just to observe the child, level it, the child needs a second examination, your child needs certain things, you can discuss it with the parents, whether the social skills are there, the child is leaving your clinic, child will say bye bye, but these kids will not respond to that. So after it's a say, the diagnosis and management, probably it's a teamwork where so many persons are involved, but the first thing is the diagnosis, and it is to be confirmed after those tests are cognitive learning tests, MChat, then modified tests, then behavioral analysis, then only will label the child as autist.
Great insights, Dr. Ravinder. And now, in certain cases, medications may be considered. So, how do you approach the decision to prescribe medicines for children with autism?
See, the medicine play a very little role. To be, you have to tell the parents, because sometimes you expect a dramatic response to the medicines. Medicines are basically required for certain other associated disorders, like sometimes the anxiety may be there, sometimes the child may be hyperactive, sometimes the child will be having head banging and other movements which may harm the child. So to control that behavior, we have got certain medicines which are anti-anxiety and which we administer, but they have got their own side effects, and unless and until absolutely they are indicated, they should not be administered. The therapy for these kids is based on how much the child is in the one end of the spectrum or another of the spectrum. So the need for a psychologist, the need for a occupational therapist, the need for a parental education, the need for a school education where the teacher needs to be trained in all those things to administer proper education to the child. In 10 to 20% of the cases, even sometimes when they grow up, they become as normal as the child should be there. And 10 to 20% of the cases it happens. But these cases get early care and they become normal. But in other cases, you have to have certain limitations, and occupational therapy, sensory therapy, educational therapy makes these kids sufficient to live a reasonable life which is desired by the parents. Another problem which I will here like to emphasize is the parents' concern, because the counseling part, as far as by a pediatrician or a doctor is concerned, to counsel the parents, because in my personal experience, if both the parents don't understand about the disease, then the blame game starts in. Sometimes they will blame the electronic media for this problem. Sometimes they will say this is an IVF baby and we are facing this problem. Sometimes they say the school education is not good and they will be blaming the teachers. So gradually over a period of time, we have to educate the parents to accept this reality and to go for the therapy. Problem in many cities is there are less of the centers and less of the people like psychologists, occupational therapists who can guide these parents, who can give treatment to these parents. So your doctor, your family practitioner can refer them to a good center where these things can be given.
And Dr. Ravindar, is there any metrics or indicators you use to monitor the progress of child with autism?
See, the thing which I have already told you is regarding that communication problem, the speech problem, the behavior which probably is desirable, the behavior which is not desirable. So once you start giving therapy, you will find the child is responding. Now, if you ask the child to tell your name and the child is not telling the name, you have to go. Some unreasonable behavior you have to ignore, and the desired behavior is to be obtained. That is rewarded and that is appreciated. Same thing is there when you ask particular question and the child has to respond to that. So many of these kids, because they are lost in their own worlds, so you have to keep them busy with the desirable behavior. Whether it's a study, you have to show him the apple and you have to constantly remind that this is apple. The color, perception, communication, then sharing with the other kids. whatever the things they are doing, unless until they are exposed to an environment where the other kids are there and they interact with that, the therapy is not complete. So same thing is, if there are speech problems, you need a speech therapist help also. And over a period of time, these kids also become have got a normal communication.
Yeah, and Dr. Ravinder, you said that sensory sensitivities are common in individuals with autism. So,
Yes.
how do you address and manage sensory challenges, and what strategies do you recommend to parents for creating sensory friendly
As far as
environments?
the sensory thing is concerned, now the vision is one of the sense, the taste
Mhm.
is one of the sense, and touch is one of the sense. So if you just expose this child to all these things, like taste is there, vision is there, but before we just label the child, his vision has to be checked by an eye specialist. Whether the vision is normal, then there are associated problems like dyslexia, dysgraphia. They are to be excluded. They are not included in that. And then, as I told you, minor things which the child gets upset, so they are to be helped in that, so that he doesn't get upset with seeing a particular thing, doesn't get scared with that thing, and the therapy will help in those things also.
And children with autism often have co-occurring conditions. So, how do you manage situations where there are additional health and mental health concerns alongside autism? Yeah, any case
Most,
study you would like to share with listeners?
most of these kids which I will help here enumerate is, it's a basically hearing problem. And sometimes the child is not responding, the speech is not developed, the child is behaving abnormally. Most of these kids who have got a congenital hearing loss, they are to be taken up first before we go for that. And if I just narrate a simple case, the child who was 15 months of age when I first encountered, the child was responding, mother did not have a clue of any problem, and she said, no, my child is okay. But when the child was playing away from my vision in other chamber, and I called the child was not responding. When I asked the mother to call up the child, again the child did not respond. Then I had got a suspicion whether the child is listening, but other parameters were okay. As I told you, eye contact, smiling, but the child was understanding the sign language. You asked the child to open the mouth, child, because the mother showed him how to open the mouth, child was opening the mouth. But when we went for the hearing test, Bira test at that time, it came out to be congenital hearing loss. And at that age, the child was picked up, child was sent to a neurosurgical center where the electrodes were implanted. And after 20 years, when I saw the child is as normal and intelligent and studying in a abroad university in a very good case and stood first. Another case, when this case of autism, first time when I saw 22 years back, that child was around 3 to 4 years, and mother was concerned that the child is not speaking, child is not laughing, and child was subjected to so many pediatricians at that time. They resorted to all that tests and reassured the parents, but the child did not respond. But when I examined the child, I said this seems to be a case of autism. And after those tests, like mental retardation, we have excluded the metabolic disorders, we have excluded the vision is normal, the hearing is normal. And then we analyzed the behavior. The child was subjected to occupational therapy, speech therapy, and today the child has completed his +2 education and is helping his father.
Thank you for sharing that, Dr. Ravinder. And it's evident that your expertise is making a significant impact. And as we wrap up this insightful conversation, do you have any key takeaway message for our listeners?
The key take message is just observe the child first, talk to the parents, spend 15-20 minutes with the parents, ask about the developmental problem, whether the child is behaving that, if there are any issues to be considered, if any birth history is abnormal, if they have got antenatal history is abnormal, if there is a family history of any mental retardation or autism or anything, because most of the time the thing is they consider it as a genetic or something. it may have got more incidence than can be proved genetically. So genetics is not of the factor. Over a period of time, many other things are being considered and fine. So the doctors, and if the child has been diagnosed with the autism, just reassure the parents, go for the therapy, go for the particular issues which, because this has to be done systematically. In what particular area you want to focus in the first instance. So once the therapy is given, the child at least will improve. Many of these kids will become almost they can live happily without the help of others. So that is the message: early pickup, early diagnosis, early treatment, and reassurance. So these things are very important.
Great. Thank you, Dr. Ravindar, for shedding light on autism management. It's been an enlightening conversation, and I'm sure our listeners have gained valuable insights. That concludes our discussion today. Thank you so much for joining us today, Dr. Ravindar.
Thank you very much. Thanks very much.
To our esteemed audience, we also want to express our gratitude for joining us today. Before we say goodbye, I encourage you to explore our MedSynapse platform. It offers a unique opportunity to engage in enriching discussions, connect with esteemed medical professionals, and contribute to the progress of healthcare. Until we meet again, take care and keep advancing in your medical journey. Goodbye.